This is truly the poetry of presentation formats. Good ideas distilled to their essence. So sit back, focus your minds, and enjoy the ride. Stacey McHenry has a Master's of Public Health with a focus on how to empower and engage communities in the process of health promotion that leads to action. She has worked with organizations that combine an academic approach with community-based needs, and she is currently working toward a PhD in psychology in the Culture and Human Development program, focusing on life history narratives of women with bipolar disorder. Stacey?
So what's possible in Saskatchewan healthcare? Using my experience as a student, a researcher, and a program coordinator for a not-for-profit health organization, I want to talk about a key approach to improving healthcare: meaningful collaboration. It might sound simple, but it's a puzzle with many pieces that can fit together in multiple ways. One level to consider in meaningful collaborative process is experiential, the level of the individual, what Ulrich was talking about. Diverse personal experiences are a great starting point because they're a rich source of information. I've included a picture of myself on vacation because this presentation is my individual perspective. Identifying and understanding the health needs of specific communities is key to collaboration. Like there are diverse individuals, there are diverse communities, and people belong to many. Some examples are specific towns, neighborhoods, demographics, or even those that support a sports team. In terms of including diverse perspective, it's essential to hear the voices of marginalized individuals and groups that may typically not be heard. Allowing these voices to shine through is invaluable to understanding health and empowering to those that have the opportunity to express themselves. Looking at existing health organizations that work with and within communities can add yet another layer. They tend to be focused on specific health issues, needs, and populations, and are a valuable source of information about what's really working and what pieces might be missing from the puzzle. Healthcare professionals of all types offer insight into their own needs and those of their patients. Not only this, but they can offer insight into the bigger picture, the healthcare system itself, and their relationship to and within it. Researchers can also contribute to the collaborative process by systematically examining areas such as health program evaluation, which everyone loves, health-related issues and specific illnesses. They provide knowledge that can be translated into practical ways, shared with the government and the public, and hopefully used to make recommendations. The government also plays a key role in meaningful collaboration. By considering knowledge gathered at other levels, they can make more informed decisions about policy or fund allocation that hopefully has a greater impact. Here's an example of a top-down approach that excludes engagement and collaboration. You can see the clear divisions between the different components that, if combined, would probably be far more powerful. Looking at this picture, I can't see how any one of these little boxes, which I conceive as sources of knowledge and potential partners, could effectively operate. The image represents a disruption to the compartmentalized approach. I've always found it interesting that the government is referred to the top, as in top-down, because it implies lower levels. Meaningful collaboration requires equality, and even if it's messy and complex, it's worthwhile. So what do I mean by meaningful? I mean that there's a need for honest collaboration and consultation, with every level being considered equally valuable, and although each level doesn't have to be involved. We're looking at possibilities for improvement, and for me, it's a mix of different sources of information. When I say meaningful, I also mean sincere. I've heard the word collaboration as a sexy word thrown in to use to pay lip service to the idea. Genuine collaboration involves real relationships and multiple types of knowledge. An honest approach is far more likely to be successful. Second question I was asked was to look at how my experiences with meaningful collaboration. Fortunately, I can say that so far I've been involved in some truly collaborative projects and have seen the benefits of this approach in action. One example is the Community University Institute for Social Health Research. CUSAR's primary goal is to facilitate partnerships between U of S researchers and the larger community, and then to use these connections to better understand health and reveal ways to address provincial health needs. I've been involved in a long-standing and highly collaborative CUSAR project, which has been going on for 13 years now, to increase quality of life in Saskatoon. As part of this, I conducted focus groups with marginalized populations, key informant interviews with CBOs, and developed recommendations for how decision makers can attend to QOL for individuals and communities. Another wonderful example is the Youth Action for Prevention, or YAP, Photovoice project. Is there a better way to understand young people's experiences with alcohol than to bring them together from throughout Saskatchewan, equip them with cameras and photography skills, and have them go out into their communities and capture images that reflect their experiences? Photovoice is an absolutely amazing technique that gives people who may be unheard a voice using images and photos and words. The YAP project resulted in Hammered, a sober look at youth and alcohol, a traveling exhibit that goes to Saskatchewan communities and other venues to initiate dialogue about young adult alcohol use. I included this powerful image about suicide, which youth linked strongly to alcohol. Unfortunately, it spurred a lot of controversy because some viewed it as disturbing. But how can we exercise meaningful collaboration if we censor the voices we aim to hear? And how can we possibly dictate what is or is not acceptable in terms of issues? This shows the pieces of the collaborative puzzle and how they put together the experiences of diverse youth and communities, organizational support and development, and strong impact of informed government funding. I began by saying that meaningful collaboration is a puzzle that's crucial for the future of healthcare in Saskatchewan. I'll end by saying that I've experienced its tremendous power. Collaboration, as messy and wonderful as it can be, is happening. And as it spreads and grows, we can work together to increase the quality of healthcare in the province.